show in the 254, where we bring you exciting topics, great music, your favorite artists, and good times.
Join us each and every Saturday from 11 a.m. to 1 p.m. at Faraja Mashup. It's your boy Big Man Kyuga.
And your boy Big Willie, aka the Big Kahuna.
Kwa majina ni John Mragori, ninaokuletea program ya uzima wa kiroho na nidhamu, na programu yetu ya kujia mnamo siku ya kila Jumapili saa 1:30 katika runinga yetu ya Faraja TV, chemichemi ya furaha. Karibu sana, karibu pamoja, tushirikiane katika uzima wa kiroho na nidhamu. Karibuni na mbarikiwe sana. God bless you. God see you through.
Welcome back, our viewers. In case you're just joining us, this is Morning Updates. And this morning we'll be talking about breast cancer. Remember, this is Breast Cancer Awareness Month, and that is where we are going to be taking you through breast cancer, what you need to know about breast cancer. You can continue interacting with us through our social media handles, and that is Facebook, Faraja TV Kenya, YouTube, Faraja TV Media, TikTok, faraja.tv.media, Instagram, Faraja_TV_Kenya, and our SMS number is on your screen, and that is 0703 339959. Don't forget to include your name and where you're watching us from. If you have any questions about breast cancer, we have a doctor here in studio, and he'll be taking us through breast cancer and what you should know about breast cancer. And with me is Crispin Okumu. He's a midwife at PGH, or Nakuru Level 5 Hospital. Karibu sana daktari.
Thank you so much.
Yeah, it's always
I'm not a doctor, but
yeah.
I'm a registered nurse
Yeah.
at PGH.
Yeah.
Pleasure.
Yeah.
Pleasure to be here
Yeah.
once again to talk to our viewers on breast cancer.
Yeah. Thank you very much for coming. It's always a pleasure having you on board. Yes, and remember, our viewers, that the reason to why we're talking about breast cancer has caused more than 670,000 deaths annually. So it's something that we should be really concerned about, because it's killing thousands of women annually. Yes, and what is breast cancer? We always say breast cancer. I know there are people who don't know what is breast cancer.
Okay, breast cancer. So viewers, remember, this is the month of breast cancer.
Yeah.
I have taken this opportunity to come live on air to teach our clients out there on breast cancer. And it has always been important to self-examine yourself. So breast cancer is indicated to all those pregnant women, to all those prenatal women, as we talked earlier the other week. Prenatal women, postnatal women, post-delivery. Those people who want to self-examine themselves annually or every 6 months, and those people who request on their self. So remember that being the month of breast cancer awareness month, so let us be aware that you have a good chances to cure breast cancer. And if you find treatment early, if you find and treat it early, it will be the better for you. So this time on, we are talking something unique, not only to the pregnant women, but also to even men, because breast cancer, even men do have breast cancer. Yeah. Wow. So we want to reach that population, but the majority are women than men.
So you see that even men can have breast cancer.
Yes. So, but with lower percentage. So, talking that, we have, before I define the term breast cancer. So the anatomy of the breast cancer. The first thing you understand that the breast cancer, the breast has the breast has some fatty tissues around it. So once those fatty tissues are destroyed, you'll find on the signs and symptoms that it will start with a small dot, something small dot that is
that is
some discharge. So you'll find the signs and symptoms. But this is how the anatomy of the breast look like. It has the pectoral muscles and the fatty tissue and the lobule, the areola, that is the outer part, then the nipple, and some ducts of the breast. And lower on it is a chest. So meaning it lies under the chest. So with that, we also have the fact about breast cancer. Without while still not defining the breast cancer, I want our viewers to understand why the facts about breast cancer. Why is it breast cancer? Why? So breast cancer, remember, it has caused more than 670,000 deaths globally.
Yes, and this is yearly.
So with that more than 670,000 deaths, the rough half of breast cancer occur in women with no specific risk. So the factor, the age and sex, you see. So breast cancer is the most common cancer in women out of 157 countries. That is 157 countries, they have breast cancer, and then out of 185 countries. You understand? So with this, so it occurs in all part of the world. All part of the world.
So you cannot see that there's a country which is immune to breast cancer.
Yes. So now I can define what is breast cancer now.
Kindly take us through that.
So viewers, remember that breast cancer, it is a disease with abnormal breast. So these are small cells that grow out of control to form what you call a tumor.
Tumors.
So, and these tumors, it spread on your breast in a spread kabisa. If let and check, so it can be fatal to human being, or to any woman, or to any man. So
especially if the cancer is not detected at an early stage, that is when we can say it can be fatal.
Yes, it can be fatal. So these cells, once it begin to spread, it start to eat the ducts, or the milk production lobules of the breast. So viewers, remember that once it spread, it also affects the other internal organ when it is serious, when it is not prevented.
And I really like the way you've taken us through the facts about breast cancer, because many people still think that, breast cancer is a curse. It's not real. But the way you've just taken us through that, breast cancer is here. There's no country that is immune to breast cancer. Also the fact that thousands of women and also men die annually from breast cancer. So, and that is why we are talking today about breast cancer. We want you, our viewers, to be aware of breast cancer. So if you have any issue regarding breast cancer, remember to interact with us through our social media handles and also our SMS, which is on your screen. We have a registered nurse, Crispin Okumo, who will be able to answer the questions that you have raised. Yeah.
So breast cancer, as we are talking about breast cancer this morning, it is not a curse. Other family think that it is a curse. But maybe to elaborate it well, it depends on how the systematically on how we need to prevent it. So the healthy diet will find it there on how we are supposed to take our diet normally. So with that, breast cancer also have signs and symptoms. And one of the signs and symptoms that you will make it early, that is according to the WHO and any other organization that have done research on this. And we, the healthcare worker at the hospital, we normally do this research. So one of the symptoms, you will start to have a lump in the breast or armpit. So you can have a lump, a small thing.
In your breast or the armpit. Wow.
So this one, you'll be able to detect. When not early detected, you will be able to assume, no, hii ni kadundo tu ka, ama ni alama tu kidogo, But remember, it is not painful, it is painless.
Yeah, it is painless.
When it starts,
so even if you squeeze it, it's painless.
It is painless. So this is the time you'll understand that the dimpling will change the skin texture. It will change the skin texture. Remember that kameanza kamvimbe kidogo, lakini sasa imeanza kubadilisha rangi ya matiti.
Okay.
So viewers, sometimes it will move to pain. Inaanza na kauchungu sasa. Remember, ilianza painless. Yes. This time on inakuja ikiwa kauchungu kidogo. Kauchungu kidogo.
Yeah. So, but is the pain severe or it's something that...
No, inaanza ikiwa mild. Inaanza ikiwa mild. So when it is mild, so that is the time you realize, aka kauchungu ni kanini. Hii uchungu, matiti yangu ninaona ni kama kidogo kuna uvumbe, kidogo ngozi, rangi ya ngozi
imebadilika.
Lakini sasa nimeanza kusikia kauchungu. Now that's the time you understand I need to visit my doctor, or my healthcare provider, or my any healthcare. So nowadays, because we are using the social health insurance, you can visit any facility. You will start with the community first. We have the CHV. Unaanza, mimi juzi nimesikia uvumbe kadogo kamemea upande wa matiti wangu na sijui ni nini. So that's the time the CHV, community health promotion, will take you to the CHV. Nearest health facility until referral to a level of level 6, where they do chemo. So so now we have the inverted nipple, the nipple that are inverted sometimes, or nipple that has discharge. So that one will make a change in your breast. Now imeanza kubadilika. The ducts zimeanza kukuliwa with the cells.
So the color has already changed.
Yes. And the ducts are already destroyed. So now you will find the redness and swelling of the breast. Inakuwa tu nyekundu na imefura. Na ni kama imebeba maziwa lakini haina maziwa. There are some few discharges inatoka tu kidogo. So with that breast cancer symptoms, I believe now the viewers, they understand the signs and symptoms, and they will be able to detect early.
Yeah, so you our viewers, and something that we're learning today, we should have self-care. Yeah.
Self-care.
Yeah.
Very, very important.
Yeah.
I will teach you on how to do the self-breast examination. Yeah. Remember that breast cancer is not only for women, also cut across even for men.
For men.
They also need to do it annually.
Annually.
Yes, yes.
And about the discharge, is it blood or what is this discharge?
Discharge can be bloody. Discharge can be bloody.
Yeah.
Yes, yes. Sometimes it starts with milky discharge.
Milky.
Then bloody.
Yeah, and it is not like you're breastfeeding or something.
Yes, yes.
Yeah.
Yeah, sure. So remember that there are warning signs that if you see them, you immediately run to the doctor.
Yeah, red flags. Yeah.
So upon repeating these warning signs, it is always important viewers to understand it clearly that if I realize there's a swelling of all part of my breast, even if no lump is felt,
yeah,
I need to visit the doctor.
You need, yeah.
If I feel something related with my skin, the skin changes.
Changing.
The skin changes, skin dimpling, look like an orange peel. I need to visit my doctor.
Yeah, that is also a red flag.
It is a red flag. So breast or nipple pain, you just feel nipple pain kanakuja kwa umbali, alafu after sometimes it becomes severe.
Yeah.
I also need to visit my doctor.
Yeah. And let me interrupt you a little bit about the breast or nipple pain, especially during ovulation or when you're almost in that time of the month. Most of the time, I think this is one of them. Is it symptoms that people feel pain on their nipples? So what about that?
So with that, during ovulation, they feel pain because of hormonal change. As we talked earlier on the prenatal care, it's one of the signs that they need to do self-breast examination every month.
Yeah.
Especially after ovulation, during the menstrual cycle. After the menstrual cycle, they do self-breast examination.
Okay.
And again, on that, the nipple or the breast that is red, dry, flaking, or thickened, it is also a warning sign. Yeah.
Yeah, and going back to the nipple pain. So if you feel the nipple pain and you're not in your menstrual cycle, you're not ovulating, that is when you may have to visit a doctor.
Sure, sure. Anything that you feel that is
unusual,
you visit the doctor.
Yeah.
So there are those causes and risk factors of breast cancer. Sasa wewe umekaa nyumbani haujui vile ni nini ambapo inasababisha matiti yangu kufura. This is your time, viewers. You'll be able to understand what causes breast cancer or the risk factors that can cause breast cancer.
Yeah, and many people think that maybe the way I just said earlier, it's a curse, it's witchcraft.
Yes. So people thought that it's a curse or witchcraft, but right now there are risk factors of breast cancer. Let us see them.
Yeah.
So one of them is family history. So once long time ago, your father, your mother, your grandpa died of breast cancer or any other cancer disease, hematological disease. So it is a risk factor to the family.
To the family.
So you need to follow up every time you visit the healthcare facility.
Yes.
So you need a follow up. The other thing.
So these are the questions that they will ask you. There's been somebody in your family who've had cancer before.
Yeah. Sure.
Yeah.
So we'll ask you when you come to the hospital, especially to the prenatal unit, or during the time of antenatal or post delivery, we'll ask you specific question because we want to know your family history. Sasa usiogope kupeana history ya familia yako.
Yeah.
It will let us know that once a while there was
is the mic.
Yes, there was a family history that has cancer.
Yeah.
So that is important.
Yeah. So
the other thing is gene mutation.
Yeah.
Remember that these things is being carried as a gene.
Yeah.
So it can be transferred from history to history, and that is family history. Yes.
Yeah.
The other thing is late
childbearing.
Important. Nilisema last time kwa prenatal care,
the best age of having children.
Is
yeah.
20 to 35.
To 35.
But above that, which is above 35 years of age, I think
it may be a risk factor of getting
of so
breast
things.
cancer.
Yes.
Yeah.
The other risk factor we talked last time was infertility on this above 35 years.
Yeah.
So the other thing is early menstruation and late menopause. So this one, when you begin your early menstruation cycle, less than 13 years,
okay,
it will increase your risk of getting breast cancer. So the normal menstruation cycle age inakwanga between 14 until mpaka 45. Unapata mtu mwingine akona late menopause at the age of above 45 years. Pia inawa increase risk factor ina increase to risk factors of breast cancer.
Yeah. So the way you've just said early menstruation, so it means that even teenagers, or young girls are vulnerable to breast cancer.
Yes, sure. Yeah. So in future watakuwa nalia, we alianza menstrual cycle yake na 12 years.
9 years.
So it increases our chances of chances of risk factors of breast cancer.
Yeah.
The other thing is obesity.
Yeah.
Ukiwa mnono sana.
Yeah.
It is also another risk factor. Kwa sababu unakuta kwamba I am obese. There are some other factors that comes in kando na breast cancer, which is hyperlipidemia. Another thing is hypertension. So it also increases the risk factor.
Yeah, of getting breast cancer.
So the other thing, viewers, if you can understand this, is very, very important.
Yeah.
Increase in breast size,
density.
Inafura tu, it can be another risk factor. And that's why they do plastic surgery at PGH to correct this.
Okay.
Yes.
So it can be done here in the level 5 hospital.
It can be done in level 5 of hospital. The other thing which is very, very, very important, prolonged use of oral contraceptive. Ndo shida iko.
Yeah.
Shida iko hapa. You know, sometimes we normally use the contraceptives that predispose us to breast cancer.
Yeah, P2.
And for your information, P2, if you use it more than twice in a year, inaweza leta infertility. Madhara yake. So we'll talk about contraceptive next time.
Yeah.
But this one is very important. On breast cancer, prolonged use of contraceptive. Wewe kila saa unatumia tu oral contraceptive kama Femiplan. Uko tu hapo unakuja unaambia daktari, naomba Femiplan. So you use it.
Yeah.
Ukitumia leo, next month utumie, for the rest of your life ukitumia Femiplan,
yeah,
utakuwa umepata madhara yake, of which it predisposed you to factors of breast cancer.
Breast cancer.
The other thing is alcohol intake and tobacco. Jamani, for those women who are taking alcohol and tobacco, this is very serious.
Yeah.
We need to reduce or leave it completely. Abstain from it completely. The use of alcohol and tobacco. Yes.
Yeah.
Very, very important.
Yeah.
So we are talking of how to prevent this. Now that we understand the risk factors,
it's now important we talk about prevention.
it is now important we talk about prevention.
Yeah, so it means that breast cancer can be prevented.
Yes, yes. Breast cancer is preventable and it can be cured. Only that if you adhere to this. One, go to and stay at a healthy weight. Uko tu weight yako. Check out your weight so that it will not predispose you to obesity. Obesity. So we are trying to prevent this so that we will not get breast cancer and other predisposing diseases like hypertension.
Yeah.
The other thing, keep or be physically fit.
Yeah, regular exercise.
Regular exercise.
That is very important.
Jogging, running, walking. You walk on distances. At least you run and you go to a gym. That one will not predispose you to breast cancer.
Yeah.
The other thing is limit or avoid alcohol.
Yeah. Because we saw earlier that it's a risk factor.
It is a risk factor. And this one, avoid consumption of alcohol at all times. It will help you to reduce these predisposing factors. Yes.
Yeah.
And then the other thing is breastfeed your child if possible. Go to a medical checkup.
Yeah.
And mammogram. You know, mammogram is whereby we visualize using an breast ultrasound.
Yeah.
So tutaangalia kama breast lump yako iko sawa. Kwa wale ambao hawanyonyeshi, it is very, very important to breastfeed your children. Usiwache. Let them breastfeed so that it release. Remember, it release the ducts inafunguka.
For how long should mothers breastfeed their child?
Yeah, the mothers should breastfeed their child from 0. I mean, from 0 month. That is
from the time they are born.
They are born. All the way to 18 months, others to 3 years. Lakini mimi nilinyonya 3 years. Utakuwa kama mimi
3 years.
3 years. And I'm healthy and strong. Yes. Kamua yote. Nataka kamue.
Yeah.
Sure.
Yeah.
So if you have a family history of breast cancer, talk to your doctor. Remember, the first thing that we realized was the family.
Yeah, history.
Is the one that predisposed you to breast cancer. It's another risk factor.
Yeah, even if you've not seen any symptoms or sign, and you have a family history of cancer, so you should just go and visit the doctor.
Sure, sure.
Yeah. Okay.
So I understand that you now realize breast cancer prevention. We'll now talk of foods.
Yeah. But before that, is there a vaccine for breast cancer?
Currently, I don't think if there's any vaccines for breast cancer.
Yeah.
But the one that we have is for cervical cancer. Cervical cancer. Sure.
Yeah.
So we have the foods that prevent breast cancer and other diseases like hypertension.
Yeah.
All these viewers, you need to understand fruits and vegetable is very, very, very important on your nutrition. So when you consume fruits and vegetables frequently, so this one will not predispose you to breast cancer. Unakula one of the fruits, unaweza kula maembe, machungwa, unaweza kula anything that inakuwa fruit, vegetables, mboga za kienyeji.
And this is because it boosts your immune system.
It boosts your immune system. You will not be immunocompressed. Wanaitwa immunosuppressed. Whereby your immunity inarudi chini. This one will boost it. And also it will increase the hemoglobin level, the blood level in your body.
Yeah.
whole grain. Unakula anything kwa cereal.
Yeah. Maragwe, kamande, ndengu.
Yeah, sure.
Yeah.
Soy pia is another thing. Fish and chicken man. Wale watu wenye wakuli fish and chicken.
Yeah.
Have you realized that I've not mentioned meat?
Na utatuambia kwa nini hauja mention nyama ya ng'ombe ama ya mbuzi.
So red meat can also predispose you to breast cancer. So it's another thing that will predispose you to other cancer and other breast cancer and other cancers.
Yeah.
Like cervix, blood cancer, and so on.
So what you mean is that we should have a minimal intake of meat, red meat.
We have a minimal intake of red meat, and we eat white meat.
White meat.
That is fish and chicken.
And chicken. Hey.
Wow, very good.
Yeah.
So how do I do self-breast examination?
How do you know that you have?
How will I know that I have
breast cancer?
The first thing is to use your right hand. That's my right hand is here. And to examine your left breast. My left breast is on this side. So I will use my right hand
to examine the left breast.
Side. So viewers, let us check where I've hold. So this is my right hand.
Yeah.
I want to examine my left breast. So check where I've hold. So I will examine the left breast, then vice versa. I'll come on the right side.
Yeah, but now you will use the left hand to examine the right breast.
Yes, yes, sure. So I will check if there is any lump. Unajua kwanza watu wa vijiji wananifurahisha sana. Wanashikanga hivi. Wanafinya hivi. Daktari, nasikia kama kuna kitu hapa hivi kwa matiti yangu yenye imefura.
Yeah.
So tunafinya tu. Unafinya kwanza. Then you check if there is a thick spot on the and other changes. You can also check a circular pattern. May help you to move in a circular pattern. Unasonga upande huu mwingine. Round. So remember, this is my left breast. I'm using my right hand to check my left breast. So ninashika tu hivi, nainua juu kidogo, alafu naenda round, naangalia kama kuna kitu imefura. Yes. The other thing, with the pads of the pads hapa, pads ni hapa katikati.
Yeah.
Now that tumetoka kwa fingers. Now with the pads, hii yote. With the pads of your 3 middle fingers, hapa katikati.
Yeah.
Press on every part of one breast. Unafinya. Unaenda round, unafinya. Unafinya.
Yeah.
So use the light pressure. Kidogo tu, ka pressure kadogo tu. Light pressure.
Yeah.
Then medium, then firm, then press the tissue nearest your armpit.
Yeah, because earlier you said that there can be also a lump in the armpit.
Sure, kabisa. Yeah. Na ukiona kuna lump in your armpit, sometimes inaanza na what we call lymphadenopathy. Unapata iko inflamed. Ni kama imepata makasiriko. Sasa inafura tu.
Yeah.
It swell. The lymph nodes huwa zina swell. Yes.
Yeah.
So be sure to check under your areola. Unaona areola ni hapa mbele. Hapa mbele. Now umemaliza kuexamine the armpit, and the rest of the breast. Now you check the areola. The black hapa mbele. Inakuwa nyeusi.
Yeah.
Check it carefully around your nipple. Then squeeze it. You squeeze your nipple to check for discharge.
For any discharge.
Sure. So repeat the step on the other breast.
Yeah.
Remember that after checking the left breast
with the right
hand,
yeah.
Now you do vice versa. Yeah. You come this side. You check it again.
Yeah.
Yes. Very, very important.
Yeah, that is very important.
So the other thing, you can check the self exam every frequently. You can do it at 6 months.
After 6 months.
During your menstrual and post-menstrual. It's very, very important. So the procedure is still the same. When you want to check it, when you lie back, you have to lie back. Unalala.
So you can't examine yourself when you're standing.
Yeah.
Or seated, well seated.
For the first one, you examine when you are standing.
You're standing. Yeah.
But for the second one, you examine when you lie back.
When you lie back.
You are in a supine position.
Yeah.
So put your right and behind your head. Unaekelea mkono ingine inaangalia hivi. You are right. Then the left, use your left hand to press down to examine the right breast.
Yeah. Yeah.
So apply a little medium firm pressure just as I will talk. And examine every layer. Yes. Then sit up, press your right armpit to check for lumps. Then squeeze your nipples and check for any discharge. Then lie back and switch arm to repeat. Yeah. Very, very, very important. The other thing, we have cancer treatment. We have talked of prevention. Now we want to treat it in a higher level. You have been referred by the CHPs, Community Health Promotion, or the CHV, from level 1, because tuko mashinani sasa. Others tuko kwa town. Now tumetoka from mashinani, being referred by the community
health provider,
promotion ama community health promoters. Amekupeleka level 1 facility. Level 2, if it was here in Nakuru, umepatana na CHP, Bondeni maternity. Now you move from the Bondeni nurses and doctors will take you to a higher level, which is Nakuru level 5. So this is the time we take it from Nakuru level 5. They will screen you. They will do a mammogram to you to detect whether it has spread to the entire body. Because remember, cancer is fast spreading. So this one will be able to do treatment of invasive, often different from, so the treatment of non-invasive breast is often different from treatment of invasive breast cancer. So typically it is called lumpectomy. So with that, we'll commence you on surgery and radiation therapy. Inachomwa. So the patient can often go to chemotherapy, whereby they take medication and other drugs. Now remember this patient will be managed on a palliative care. Like Hapa PGH, we have a palliative care, and any other hospital, Nairobi Women, I think they have a palliative care. We have, there's another hospital, Blooms, they have a palliative care. Valley Hospital, they have a palliative care.
And you said it. How is breast cancer treatment accessible? Because most of the time you will find that, most hospitals don't have facilities to treat cancer. How accessible is it?
So breast cancer treatment is accessible to all level 5 facility and level 4, some level 4. Yes. It is accessible. And for the level 3, they'll have to refer to level 4 or level 5 and level 6. So level 6 is where they do chemo. They do chemotherapy. And they also do, they are fully equipped, so they have everything to detect cancer.
And again, the cost of treatment. Yes, that is a problem, because many people see that, it's expensive.
So the cost of treatment is very expensive. And the best thing is when you have insurance,
medical cover,
kina Jubilee, and today tuko na SHIF. That's the reason why SHIF came, at least to be to balance the community that lives in a rural area. They have to register for a SHA. Then they will be treated same with that one with the one that has Jubilee insurance, with the one mwenye akona First Insurance and the other. So the treatment right now, the government has taken it to a higher level, of which they are doing a good job.
Yes, and our viewers, that should not be a reason to why you're not going to hospital when you're having these signs and symptoms.
Sure.
Remember that when the cancer is detected early, it can save your life.
Sure. So we have the complication of it. Sometimes when you take this medication or you undergo through chemotherapy and radiation, so there are complications of this. The first complication is lymph edema. So you have to do a little available exercise to reduce the effect. So we also have neutropenia, where there is reduced neutrophil, and infection. Sometimes they get infection, nausea, fever, chills, and without forgetting hair loss. Ukiona kuna nywele, alopecia, nywele inapotea, visit the healthcare facility.
So, but is it after now chemo or even before chemo?
This is now. Remember when you have breast cancer, kuna ile wenye hawapotezi nywele. Lakini now that you have started, because of anxiety, anxiety disorder imeanza kuingia, una mawazo imeanza kukua mingi, you have started the chemotherapy. Now this is the time you will have hair loss. So wengine hawakui hata na hair loss. Yes. So some wengine wanapata blood clots, whereby the blood in a clot itself, but they have to be given anticoagulant. So chemo also affect brain, na inaleta what we call neurodeficit.
Yes, and but that shouldn't be the reason to why you don't visit the doctor, because these effects may scare people. But remember, if the cancer is early detected, you can be able to save yourself. So if you have any of the signs and symptoms, the way our registered nurse have taken you through, the swelling of the breast,
swelling of the breast, discharge. When you mean by swelling, it has to be accompanied by the red. So
lump in the breast, breast pain, breast dimpling or skin texture changes, inverted nipple or nipple discharge, change in breast shape or size, redness and swelling of the breast. And remember, our viewers, that breast cancer is real, so it's not a witchcraft, it's not a curse, and no one is immune from breast cancer. And 67,000 people,
670,000,
670,000, both men and women, die annually from breast cancer. So if you have any of the symptoms that Crispin has taken us through, please visit the doctor. And also remember to self-examine yourself after every 6 months.
Every 6 months. For the ladies, you can do menstrual cycle.
That is key. So, and if you find out that you have any of the symptoms, kindly visit the hospital, because that can really save your life. Especially the self-examination and the fact that we should have me time, self-care, self-love, where you have to listen to your body. Most of the time we are busy. We came to realize of the breast cancer at a later stage. That is when it becomes fatal. So make sure that you take time to self-examine yourself, and you can do that after every 6 months.
Every 6 months. For the ladies, you do it especially daily. Yeah, very, very important.
Yeah.
Yeah. So with that, I want to thank my viewers.
Yeah.
I want to thank my viewers. I believe that now they have got little knowledge on breast cancer and where to find my services.
Yeah, where can we find you?
So you can find my services at Facebook, Chris Okumu. You can also find my services at Pregnant Women. That is Facebook. Then still on Facebook, the Crispin Medical Clinic, still on Facebook. TikTok, Chris Wayback. And then finally, Nakuru County Teaching and Referral Hospital, Mother Baby Wing.
Wow. Yes, and I hope this has been a very educative, a session. I've learned a lot, and I know that you've also learned a lot at home. Continue interacting with us even off air. Our social media handles is Facebook, Faraja TV Kenya, YouTube, Faraja TV Media, TikTok, faraja.tv.media, Instagram, faraja_TV_Kenya, and our SMS number is on your screen, and that is 0703339959. Crispin, thank you very much for joining us.
I appreciate.
Yeah, it's
remember, I'm also doing home-based care without forgetting that.
Yeah.
So for those people who want me for home-based care and management of breast cancer and any other condition they have, they can get me on my number. That is 07 9550 9087. Remember that these services can also come with a doctor, depending on how you want to be helped or you want to be assisted. We can also come with a nurse assistant on this. Yeah, sure.
Thank you very much.
Welcome.
So our viewers, let's do this again tomorrow, but now without the doctor. From 7:30 a.m. to 9 a.m. Have a lovely day again. Happy Mashujaa Day.
Thank you.
Faraja TV, chemichemi ya furaha.